Okay, so now we're ready to trim our upper and lower custom trays. And of course, we're going to have some wax residue left onto the models. And we can simply boil these off by some hot water. I just want to remind you again that if your models are dry, they've been sitting around for a day or two, that you submerge your models into some water before you introduce some hot boiling water to boil off the wax. Otherwise, you're running the risk of them breaking. So I'll put these in a work tray, and then I'll submerge them in some water, leave them in there for about 4 or 5 minutes, and then we can boil off the water. Ty. While that's happening, what we can do, we can work a little bit on trimming our custom trays. So if you recall, on the upper one, I cut it right to the line. So I think I was very accurate in terms of the extensions of the tray. So the only thing I have to do now is basically round off this little ledge here. Just round it off. You can do a number of ways. You can do it by using your handpiece with a small tapered burr. You can mount that same tapered burr to your lathe, or you can mount a large tapered burr to your lathe as well. I find this method to be a little more productive in terms of doing it. And you can do it very quickly. Okay? So once again, make sure that you have on your eye protection, your mask, and your vacuum is turned on, and before you start doing anything. So I'll take off this little mat here because I do have an exhaust vent here. And I'll turn on the vacuum. And what I'm going to do for the upper, I'm just going to round off the outer edge and the inner edge where I cut the tray back. As you can see, there's very minimal reduction here because I was very careful to cut it right to the line. So I'm going to continue with that all around. Obviously, this large burr, or even the small one for that matter, cannot get inside the Frenel attachments. But we're going to get in there with this cutoff disc here that we pre-mounted and prepped and tapered a little bit, as you recall. So we're going to go all the way around. And what I like about the lathe is it allows me to rest both of my forearms on the bench, and I have full control by using both of my hands. Versus here, my hands are separated and I actually have to join them together by creating a little pivoting point. I find this creates a much more stable position for me to work. And I could be much quicker finishing the tray or whatever else I'm working on by using the lathe and a large burr. And as far as the trimming is concerned, that's done. I am done with the trimming, with the exception of cleaning the Frenums a little bit, as far as this burr is concerned. This tray handle here now. If you find that the tray handle might have some sharp edges to it, you can certainly round them off with a burr. But let's assume this tray handle is a little bit on the long side. So I want to reduce the top portion of the handle by about a couple of millimeters. What's the best way of doing it? I can use my handpiece, but I think I'm going to be here for a long time trying to reduce this large area with a small with a small burr. I can use the tapered burr too. I could. So I've made an alteration to that surface. Or I can get my big grinding stone, and this is going to come into play when we finish the lower custom tray even more so. So I'll mount on the wheel, secure it into position, and now I have an excellent view to where I need to cut, and that happened very quickly. If you do the same thing with the handpiece, it'll probably take you 10 times as long. So try to use your large burrs as much as you can. I'm even going to use that just to round off the edges of the handle, or at least the sharp edges that I've created, and maybe shape the handle a little bit, because I feel that now that I'm looking at it, is a little bit on the wide side. So now my handle looks a little smaller, a little thinner, and a little more rounder. So the next thing I'm going to do, I'm going to remove this wheel. And I'm going to round off the Fresnel attachments a little bit more. And you want to make sure that you have a nice rounded finish in here so it's not sharp and not cause any damage to the patient. So turn it on and approach it in the angle that you created already. And all I'm going to do is round that off, as well as the outer edge and the inner edge. If you can't get inside with the disc, you can use a smaller burr mounted onto your handpiece and get in there and trim it up a little bit. But I think for this case, this should be enough. And a couple of more to go here. So this cutoff disc works very effectively when it comes to Fresnel relief. And we're going to use this again later on when we start fabricating stable base plates for the bite blocks, as well as finishing the case in acrylic. So just for good measure, I'm going to put on my large tapered burr, 3/8 burr, and just give it a once over in case I missed something the first time around. I'm not reducing it, I'm just gently rounding it off the models. To make sure nothing is rough that could cause harm to the patient. And maybe a little bit more around the handle. going to round off this handle just a little bit more. Now, some people might want to scuff this whole side. You don't really have to. We're not selling custom trays. We're utilizing them, but they do have to be presentable. Okay? And maybe we can spray this with some Biotex before we try to fit it onto the model. So I'm just going to use my air hose just to clean this up. And you can see here in terms of how rounded the edges are. The Freno relief being rounded as well. And I'm just going to use just a disinfectant wipe for now, just to wipe this down a little bit so I can assess the fit back onto the study cast. So I got my maxillary cast here. It's been boiled off. The lines are still there. And this should have a very passive fit onto the model. It should be very passive. And it should be very close to the line that I created earlier. Okay? This is an educated guess where we think the denture is going to finish, but it's got to be fairly close. I find a bit of a wedging effect right back here, and I think it's because this might have been distorted during curing for some reason, or maybe I moved it when I was prying it off. So what I'm going to do very carefully, go back and relieve it a little bit. And possibly any other undercuts that I might have missed with my block out. So when in doubt, block out a little more than you need. I think it's going to help you more than anything. So I'm going to try that now, and that feels a whole lot more passive now. And this is how the tray should feel. So if I turn this upside down, it should fall right off the model. Okay? There shouldn't be any engagement of any undercuts. So this tray is good to go. The only thing I would have to do to this tray before we see our client, I would spray it with a disinfectant, rinse it off, put it in a Ziploc bag, and it's ready to go to the clinic. The lower tray is very similar. The only difference is with the lower tray, because we use the wax relief, we have a bit of a lip all the way around that we need to trim that back. Again, you can use your handpiece, you can use your lathe with your tapered burr, you can use an egg burr, a large egg burr, or a small egg burr. But I think with everything else that I do, at least the way I do it, you can certainly try a different way. I like to start off with my biggest trimming wheel. And I like this wheel because it gives me a proper angle to look at what I'm trimming. So turn on my vacuum. And again, you want to trim at right angles. Of the surface of the custom tray. Now, it's very difficult to get in there with a big wheel. I can only go so much with this, so I might have to bring in a smaller burr or maybe even the disc. to fit in there. But I'm gonna do as much trimming as I can with this, because I find this wheel very, very effective. So the next thing I'm going to do, I'm going to round off the periphery. I think I'm there, but I'm going to round it off going back to my tapered burr. So I'm getting smaller and smaller and smaller, trying to get to the smaller little spaces to whatever I'm trying to trim. So back on to my large tapered burr. And just like we did on the upper, I'm going to round off the peripheries, possibly reducing some of the undercuts that I might have missed through my block out. Although this one, I think you'll find that it's a lot easier to fit and work with because of the wax spacer that we use as relief. So I can get a little bit closer in here now inside this lingual frenum. I don't think I can get all the way in with this burr, but I'll finish it off with this little cutoff disc as I get closer and closer. But right now, I'm just trying to round things off. You're not going to make them super smooth, but as round as you can possibly finish it. So when you are feeling it with your fingertips, it's very smooth to the touch. There's no roughness, there's no edges there for me to feel. Because if you can feel it with your finger, certainly the patient's going to feel it with their cheeks and their gums and so forth. So I'm going to round this off as much as I can. I'm not worried about the handle or the finger rests right now. I'll get to those in a minute. It's okay to trim on the underside of the tray if you felt you don't have sufficient relief. So I'm going to take that off. Put on my cutoff disc. Make sure that it's centered and balanced. And open up the frenal attachments. So you're going to go a little more. And you're going to round off the outside as well as the inside. Either with your disc or possibly a much smaller tapered burr that fits the space. And one more on this side. Just going to use my air nozzle to blow that off. So you should have something like that. And of course, I'm going to go back and give everything a once over in terms of having it nice and round and smooth. One thing that I forgot to do is to relieve this lingual attachment here, or this lingual frenum. So I'll open it up just a little bit more. And that looks, I think, okay. So I'm going to bring in the study model and see how this fits onto the study model, and hopefully I'm very close to the lines that I had there before. Pretty good, as you can see there. Just zoom in for you guys. I'm a little bit off here. I could end up making a new tray because I'm short of the line. But again, the line is just an educated guess where we think it might be. We just have to be relatively close to the line. If we're off by one way or another for about 1 millimeter or so, it's not the end of the world. We can compensate for that through our border molding technique and our final impression. Okay? But we have to be close. What's important is that to make sure that we have retromolar pad coverage, we have adequate extension in the retromylohyoid area. Okay? We have relief of all frenums. And now, let's talk about the height of the handle. So the height of the handle should be approximately, whether it's the handle or the finger rests, should be approximately 2/3 up the retromolar pad that we talked about last time. So in this scenario, I'm going to have, whether you're doing a finger rest that runs from one side to the other that we talked about before, whether you're doing a single finger rest on one side, or just doing a handle for that matter, just at the front here, it shouldn't be any higher than what you think the height of the teeth will end up being. Right about here. So basically what I'm gauging it at now is about 2/3 up the retromolar pad. And also, if you notice, that I'm keeping that line parallel to the base of the model down here. So it's parallel. And why do I keep it parallel? Because I made sure that I trimmed this model so that the crest of the ridge is parallel to the base of the model. And I know the plane of occlusion eventually will end up being parallel to the crest of the ridge, which is parallel to the base of the model. So all I got to do now is get rid of that excess material and shape my finger rest and or handles, whichever you choose to do. So I'm going to bring back the lathe. Turn on the vacuum, safety glasses, mask, and I'm going to use the big wheel and watch how quickly this happens. This doesn't take a lot of time. That's done. So I think it takes a whole lot less time than trying to cut it with a surgical blade when you're adapting this, and you'll get a much cleaner look. So the only thing left to do with this tray is to round off the edges of the handle or the finger rest, whichever way you choose, so the patient doesn't feel any sharpness in their mouth. Possibly alter the thickness of the finger rest. You might have made it too wide. Make sure they're centered over the ridge. To ensure you're putting pressure over the center of the ridge, so you're stabilizing the tray. And I'm going to go over the periphery just one more time, just to give it a final once over. To make sure things are smooth. as much as possible, and definitely rounded. Nothing sharp, nothing edgy. That's going to go in the patient's mouth. One more thing, the tissue stops that we have here, created by the wax relief, sometimes you get a little sharpness around the tissue stops. It's a good idea just to gently go over them, not alter them, but just go over them with a burr to get rid of any possible sharp edges there. So I'm going to wipe this down one more time. And we'll give it a final look up against the master cast, or sorry, the preliminary cast. Master cast would be after we take final impressions. This would be the study cast or preliminary model that we're assessing it up against. Okay. Still have a little bit of wax here. That needs to be removed. I guess that didn't come out in the boil out, but we can simply take that out and see how that fits up against the cast. So once again, if I turn this thing over, it should fall right out. We shouldn't be engaging any undercuts. Okay? And because of the wax relief, it's quite a bit of wax relief back here, but that's okay. And because of our wax spacer, the wax spacer, through the use of the tissue stops that we created, it's going to maintain the height of the spacer inside the patient's mouth. Whereas the maxillary one is a little bit different. This one, we're going to have to create those tissue stops in compound, intraorally, utilizing our patient. So therefore, the maxillary custom tray is going to elevate off the tissue that much. Okay? Whereas this one, it's already elevated. We don't have to worry about that. Okay? In fact, if you're using a wax spacer, what you want to do is actually cut the tray slightly short of the line. Okay? So that way, because you know you don't have to elevate the tray anymore, so the tray needs to be cut slightly short of the line, about 1 millimeter or 2, to allow room for the compound material, for border molding. Okay? So once more, no spacer to the line, because I anticipate this lifting off the tissue while we incorporate the tissue stops intraorally. If we're using a wax spacer, I already have my tissue stops. So therefore, this tray needs to be cut slightly short of the line. I'll do this off camera and we'll revisit and we'll do a final inspection of the custom trays and how they're gonna, how they should be finished one way or another.